Hi guys, this is Dr. Nida with Keys of Health. As we know, COVID cases are still out of control in some parts of the world, and the new strain is affecting younger children. I have had many requests to share a prevention and treatment plan for children, so this is what I'm going to do in this video. Before I start, I would like to clarify something. I will never recommend not getting medical care. You should consult your doctor if you get any infection. But what can you do to prevent an infection? And when cases are surging and hospitals are overwhelmed and getting immediate care is difficult, if not impossible. So what should we do in a situation like this? Get tested and then what? What to do to make sure that the infection does not progress? This is what I want to talk about in this video. Children's plan will look very similar to adults' plan that I have shared with you previously, but children are challenging when it comes to eating and taking supplements. So I have tried to put together a very simple plan with nutritious foods and herbs to add to their diet along with some supplements. So let's start with food. Children can snack all day long, especially when they're home all the time. It can be very challenging to keep them on a healthy diet. The best thing you can do is to have fresh fruits and vegetables for snacks. Don't have packaged foods at home. Salts, spices, and chemicals that are used in packaged foods and junk food stimulate the reward system in the brain the same way as addictive drugs like cocaine. So it becomes an addiction. You keep going back and forth for more. If you manage to replace junk and packaged food with more nutritious snacks, it will help curb their appetite and constant munching and get a lot more nutrients in them without a struggle, hopefully. Smoothies are also a healthy and easy snack. You can hide a lot in a smoothie. Put in some greens like kale, spinach, moringa, chlorella, seeds, nuts, and cover it all with the sweetness of fruits. Now, this is an important point. You don't want to give anything cold to children during this time, whether they're displaying any symptoms or not. I know it can be very difficult when during the summer months. Neither should you consume any cold foods because COVID affects the lungs and cold is not ideal for lungs. You should consume everything at either room temperature or slightly warm, even in the middle of summer. The warmer, the better. So warm drinks like broths, soups, herbal teas, they're ideal. They should be a part of your regular diet at this time. Another thing you want to avoid at a time like now, and especially in case of an infection, is dairy. Don't give kids anything dairy. If the child is too young and only drinks milk, that's different. But you want to avoid milk as it can aggravate the infection and congestion. Other than that, when it comes to food, keep it simple and keep it natural. The more colorful your diet is, the better. And make sure it is fresh and not out of a package. It is very important to care about children's emotional and mental well-being as well. Don't think that children are not stressed. They are. And they also internalize adult stresses. So try to talk to them, explain the situation to them, and find alternative things for them to do to make sure that they are engaged and make up for what they are unable to do at a time like now. Now, let's talk about supplements and herbs. If your child has any underlying health conditions or any allergies, please do not give them anything without consulting their doctor first. Please be careful. Do not give them more than necessary. The preventive dosage is half of what you would give in case of an infection. So if the recommended dosage is, in case of an infection, is 30 milligram, let's say, cut it down to 15 for preventive dosage. Also, the dosage would differ based on their age, so please be mindful of that as well. These are the 4 supplements I would highly recommend for children. Vitamin C, vitamin D, echinacea, and zinc. All of these supplements are available as tablets, gummies, and in liquid form, so you can choose what works best for your child. You should give each of these twice a day, especially in case of an infection. So if the total recommended dose for children between 14 and 18 years of age is, let's say, 250 milligram, then you can divide that in half and give it twice. But it is not written in stone. You can give it only once a day and that would be fine. This is how much vitamin C children need. Of course, it is better for children to get vitamin C through food, But in a situation like now, when the cases are rising and they are vulnerable, supplements will ensure that they have adequate amount of a particular nutrient in their body. They should eat vitamin C rich foods like citrus fruits anyway, whether they are taking the supplement or not. Besides vitamin C, children need vitamin D, and this is how much vitamin D children need at different stages of their lives. Remember, the best way to get vitamin D for all ages is through the sun. Children need to be in the sun. If you can manage to get children to be out in the sun for at least 30 minutes a day, please do so. Let them play in the yard or take them for walks where you can maintain social distance. If you don't have an outdoor space, open up the windows when there's sun out and let kids be in the sunlight. The third supplement I recommend is zinc. Zinc is a very important nutrient when it comes to fighting infections. Zinc deficiency can cause growth-related issues in children. So make sure they're eating zinc-rich foods, and during this time, give them a zinc supplement as well. It is recommended. The next supplement I recommend is an herb called echinacea. Echinacea is a great herb to give children on a regular basis. It has a lot of benefits, including reducing the severity and duration of the common cold, reducing upper respiratory infections, reducing inflammation in the body and brain, lowering blood sugar levels, reducing feelings of anxiety, and it can also help treat acne and heal wounds. Echinacea is a great herb to have in every household with children. It is an immunity booster. It's light on the system. It helps ease the infection symptoms and also helps rebuild immunity quite quickly for a speedy recovery and to prevent a possible relapse. It is better if you follow the dosage recommendation on the supplement that you buy. If you find zinc or echinacea with other herbs like elderberry or astragalus, that's also fine. There is no problem in getting a combination supplement. The next thing I recommend is honey and molasses. These are some of the best things you can give your children to enhance their immunity. I would recommend Manuka honey since it has antimicrobial properties. You can give them a teaspoon of honey twice a day as is, or you can give it with some warm water to make sure they are drinking enough water. Because COVID is an upper respiratory infection and you want to make sure children are drinking enough water and their lungs are well hydrated. Dry mouth and dry lungs are an invitation for infection. Blackstrap molasses, pomegranate molasses, or carob molasses are all great for children. They're sweet, so easier for children to consume. They're good for immune system as well as lungs. You can also mix some black seed or flaxseed oil in the honey or molasses, so it is easier for children to consume since they may not be responsive to the taste of oils. So the next thing is 1 teaspoon of black seed or flaxseed oil once a day. Black seed is definitely highly recommended because it has great antimicrobial properties and it is very, very good for the immune system. So you really want to consider incorporating it in your and your children's routine. Next thing I want to talk about is frankincense. I would highly encourage you to get frankincense resin and essential oil. It helps clear the nasal passageways, relieve congestion, and promotes easy breathing. Make sure you buy food-grade resin because it is also used as an incense and there is a quality difference between the two. You take a few pieces of resin, soak it in water overnight, and let your child drink that water in the morning. And if they can't handle it, let them chew the resin. It is bitter, so if they can't chew it, that's fine. It is also great for asthma. So if your child is asthmatic, you can give them this water regularly. You can use the essential oil for steam inhalation, which I will discuss in a few minutes. Another way of using frankincense oil is to massage the chest and back with it. Make sure to always mix essential oils with a carrier oil. Don't ever apply it directly on the skin. You can mix frankincense oil with coconut, olive, or mustard oil. Keep it 1:10 ratio. So for every drop of frankincense oil, you add 10 drops of mustard oil, let's say. It is quite potent. So if it irritates the skin, you can dilute it more. Massage their chest and back at least twice a day if they have an infection. And for prevention, you can do it once a day or at night before bed. It will really help relieve the congestion and warm up the chest. You can also massage with mustard oil and turmeric powder. It warms the chest, reduces the inflammation, and helps relieve the mucus. You can add a teaspoon of turmeric to half a cup of mustard oil. Warm it up until it sizzles, so you are kind of cooking the turmeric in the oil. You can apply it warm. It is fantastic, but be prepared for stained clothes and skin, and I have to warn you, it does stink, but it works wonders. You can also put it on the soles of their feet and their toenails and fingernails. Soles of the feet have the largest pores, and the oils are able to quickly pass through layers of skin and release their benefits into the body. Also, it helps trap the heat inside, so it helps if the child is feeling cold. Now let's talk about steam inhalation. It is very important to open up the passageways and ease breathing. For young children, I would recommend getting a steamer since it is safer than an open bowl of steaming water. For babies, you can run a hot bath and sit with them in the bathroom so they can inhale that steam. You can add up to 15 drops of any of these essential oils to steaming water and inhale deeply into the lungs, or teach the children to inhale it deeply into their lungs. Eucalyptus, peppermint, spearmint, oregano, tea tree, and frankincense are all very good for this particular purpose. If your children are old enough to be able to gargle, I would recommend gargling with salt water, preferably Himalayan salt. Last but not least, teas. Warm drinks are your friend during this time. Ginger tea with lemon or honey, ginger turmeric tea, hibiscus tea, pomegranate tea. These are all flavorful teas which are rich in vitamin C that children can enjoy. You can always add honey or lemon to enhance the flavor. If, God forbid, their temperature is too high and they're developing breathing difficulties, you don't want to wait and consult their doctor immediately. If you can get tested where you are, get them tested as soon as the symptoms first appear, and make sure you follow the recommendations of the doctor. And keep these as supplementary methods. I wish you and your family well. Stay safe, stay blessed, and stay indoors. Please subscribe to my channel and share this with your family and friends so we can prepare and help as many people as possible. Take good care of yourself and your family. See you very soon with another video. Until then, goodbye.